Hi, I'm Dr. Jen Tyra, and I'm the owner of Envision Physical Therapy and Pilates. Today we're going to talk about diastasis recti. So a diastasis is a separation of your linea alba, which is the midline of your abdomen that runs along here. And during pregnancy, this connective tissue starts to lengthen in order to make room for the baby that's growing inside. And I want you to know that this is normal and this is a natural part of pregnancy to have this separation. So after giving birth, however, sometimes this separation doesn't always close quite as well as it should. And today we're going to talk about how to measure this at home. But before we even go through the measurement, I want you to remember that the gap of the separation is not nearly as important as what you're feeling. So if you are having things like back pain, hip pain, SI pain, or you're having trouble returning to running or exercising without having any kind of leaking, then these are some signs you might want to see a PT and get some help if you're having that separation. But if you want to just measure it to see what's going on, what you're going to do is lay down on your back, your knees are bent, feet are flat on the floor. You'll find your fingers and you're going to place them right above the belly button. You're going to gently sink your fingers into the tissue, and then you're going to lift your head up and a little bit of your shoulders. And as you're here, you're going to feel, is there a separation or is there a gap between your two muscles? And you'll come back down. You want to measure to see how many fingers can you fit between that gap. Next, you're going to come right up to where the rib cage is. So you'll find the rib cage at the sternum. You'll place your fingers there as well. You'll sink into the tissue. Lift your head up and again feel, is there a widening there between the muscles? Come back down. And then you're going to go to the bottom part. So you find your belly button. You go a few inches below. Maybe you have to move your pants out of the way. Sink your fingers into the tissue. Lift on up. And come back down. So again, you're looking for how many fingers can fit between that separation, and that's the measurement that you're looking for. So again, it's not always about how wide the gap is, or even if there is a gap. It's about, are you using your abdominals correctly, and are you having any issues? So if you're having issues like sitting up without pain, picking up your baby without pain, if you're having a hard time getting back to your favorite exercises or running without leaking, then these are some signs that you might want to get checked out by a physical therapist. So if you're having any of these issues, this is a good time to call a physical therapist, and I would love to chat. So send me a message and let's find out what we can do for you.